In general, the optimal treatment for patients with metastatic hormone receptor positive breast cancer is endocrine therapy. However, unfortunately, eventually all cancers will develop resistance to endocrine therapy. And the mechanisms that cause that resistance are very complex. However, what we do know is that increased signaling through growth factor receptor pathways and the PI3 kinase and MAP kinase pathway appear to be have important roles in endocrine resistance. And what we think happens is that activation of these growth factor receptors sets off this phosphorylation cascade, and somehow, which we don't understand, it affects the estrogen receptor. So the estrogen receptor is no longer a viable target for endocrine therapy. So the important clinical point about the fact that these pathways are important is because we have lots of different agents that target various parts of these pathways, including VEGF, HER2, EGFR, insulin growth factor receptor 1, and then also the final common protein of these pathways, which of course is the mTOR protein. And that's really the one that has been shown, inhibition of mTOR has been really shown to be the one that's appears to be one of the most important in reversing resistant endocrine therapy.